Okay, so the next step, I've been numbing for about 45 minutes right now, and now one of our nurses is wiping off the numbing medication with micellar water, which is not irritating at all. Right now my face just feels very numb, more so around the eyes and the lips than anywhere else. So this should really make me not have too much discomfort during the halo. I know there's a lot of YouTube videos out there right now that show halo videos and patients in more pain than they should be in. I want you to know at Ocean Drive, we literally do everything possible to make the experience as pleasant as possible. And honestly, the majority of patients, probably over 95%, have about a 1 or 2 out of 10 on the pain scale. The two areas that I'm going to be having done to me with halo today is going to be the face and the under eyelid area here. So I'm going to go ahead and select those two areas on the halo. And the first part of halo is mapping the face. We need to just determine how large each of these sections are on my face. And then after that, we're going to go ahead and actually program the two different lasers and the depths that they're going to fire during the entire treatment. So the whole halo laser process is actually fairly quick. Depending on how aggressive a treatment you're having, it could be a 15-minute treatment for the entire face. So I'm doing a more mild to moderate treatment, and the whole treatment will probably only take about 15 to 20 minutes total. And when we do halo, we do it in sections. So right now you'll see that we're focusing on the right cheek, right chin, and right upper lip area. And then we'll do the same thing on the left side, then we'll move to the right and left forehead, and then we'll finish with the nose area. And one of the things that we do here with all of our patients, we provide the option of doing the lower eyelid area. So we can actually complete the halo laser up to where your eyelashes grow on the lower lid. And we use a different type of safety shield to do that, but that stimulates collagen in one of the thinnest areas on your body, so that's only a good thing. So this treatment's going to help the crow's feet, it's going to help my pores, it's going to eliminate a lot of brown spots that I have underneath the skin, some of the brown spots that I have on top of the skin, and it's a gift that keeps on giving. So my end result from this halo is about 12 months from now, so it's going to stimulate collagen. And I'm not going to notice those results immediately, but somewhere around the 3-month mark, I'm going to start to see what we call a collagen bloom, and things are just going to look so much healthier and more plump than they did. So in the area of the crow's feet around the eyes, those lines are going to start to fill in. So this is a great treatment to have done every 12 months. And this is just one part of, this is just one treatment that you can do to continue to help rejuvenate your skin. Other things this pairs well with are microneedling with PRP, our Saphiro treatment, our All-Therapy treatment. So it's not just all in on halo and do nothing else. You really want to vary your treatments, but stay consistent with it. And right now you're probably noticing my skin's getting red, and that's normal. Now that we're moving on to the other side of the face, the left side, I am starting to feel a little bit of heat on the right side. Nothing more than what a sunburn would feel like, which is completely normal. This heat is because of the halo lasers delivering heat energy into the skin, and this is completely normal. Okay, so now we're moving on to the forehead. We get as close as we can to the eyebrows without actually not lasering the eyebrows. And after the halo treatment, there's going to be about 2 hours of heat that has to leave your skin. And part of all of our halo packages, we provide patients a halo recovery bag, and that's going to include MedSpa grade recovery products. So we like to use the ZO product line and the SkinCeutical product line. So that's going to include a gentle moisturizer, a gentle cleanser, and a special sunscreen to be using during your recovery. After every halo, about 24 hours later, we like to bring you back into the office for red light stim. And this is included in every halo package. And this helps accelerate the healing process. It helps reduce inflammation, helps reduce swelling, and increases blood flow to the treated areas. All things that we know are proven to help the healing process. For patients that have history of cold sores, or what we call herpes simplex virus 1 on the lips, we do recommend pre-treating with an antiviral medication. If that is the case, we would prescribe and send that to your pharmacy to take 1 day before the treatment and for a few days after treatment as well. Any heat-based laser can cause a cold sore outbreak. Luckily, I've never had that happen with the Halo laser on any of my patients. But with that said, we've also pre-treated all of our patients that we know have histories of cold sores. So we just finished the right side of the forehead, and now we're working on the left. And one of the nice things about Halo is that it's really quick. So we've already finished the right cheek and left cheek, which is the largest surface area that we're treating. So that takes the longest. So the forehead and the nose go very quickly. And with more aggressive treatments, it's not necessarily more painful or anything like that. It just takes a longer time to complete the treatment. And again, I'm not really feeling any pain right now. I do know that I'm having Halo done, but it does not hurt. So let's say that during the treatment, you decide that for whatever reason it is just too painful for your liking. Now we all have different pain levels and pain sensitivity levels. So if the topical numbing medication and the cooling of the laser through the Zimmer chiller is not enough, we do include Pronox with all of our laser treatments. Pronox is a mixture of 50% oxygen and 50% nitrous oxide. And the combination of those two things help reduce anxiety and help reduce the pain sensation throughout the treatment. The nice thing about this, it is patient controlled. So you simply breathe it in through a tube and you use as much or as little as you need. And because it's 50% oxygen and 50% nitrous, it leaves your body about 3 to 5 minutes after your last inhalation and exhalation. So that means you can safely drive yourself to and from the procedure and not have to worry. Nick here again, and I am post my Halo procedure. It's been about 16 hours since I've had it done. And as you can see, my face is mildly red. When I woke up this morning, I had a little bit of swelling kind of under the right eye here. And once I was upright for an hour or two, that kind of disappeared. I have not taken any special medications during recovery. I'm just using our aftercare products, which is the Zeo product line and SkinCeuticals sunscreen. I've already had my red light stim treatment this morning. That's what's included in all of our Halo packages, about 24 hours post-treatment. That helps reduce swelling, increases blood flow, and it just accelerates the healing process to make you recover a little bit quicker. The only thing I didn't have done yesterday as part of my treatment was adding PRP to the mix. And that's one of the things I really like to do. I just didn't have time, unfortunately, to do it yesterday. And by applying PRP to the face immediately after the Halo procedure, it's going to induce more collagen stimulation, so you're going to get more benefit in line reduction, and it's also going to help accelerate the healing time for us as well. And that's not just what we've seen in practice. This has been studied and proven, so we love offering proven solutions, and it gives you better outcomes as well. So again, I'm about 16 hours post Halo, and we're going to continue to take daily photo shoots so you can kind of see my timeline progression, and we'll keep you updated. Nick Wolchin here. I'm now about 48 hours post Halo, and as you can see, as time has gone on, my face has gotten a little bit more red, and you'll start to see some of these brown spots come out. We call that the MENS, or microscopic epidermal necrotic debris. And that's basically all the damage that the Halo laser did underneath the skin, stimulating collagen, is now coming up to the surface. This typically is most prominent around day 2, 3, and 4. And based on my progress thus far, I expect to be completely healed by day 7. And all I'm doing at the moment is putting on a moisturizer a couple times a day and washing my face with a gentle cleanser. I have no pain. It doesn't feel like a sunburn. It might look like that, but as of now, I just anticipate moisturizing for a few more days, and then I'll start to notice these little brown guys flaking off and then normal skin underneath. Nick Wolchin here again, and I'm on about day 4 of my halo recovery. Last night, as I was washing my face, the majority of the brown mends came off the face. And right now, I'm just kind of left with a rosy red glow. My skin's still a little bit rough, so there's still a little bit more exfoliating that needs to be done. But for all intents and purposes, a mild to moderate halo treatment takes about, 4 to 7 days for full start to finish recovery, but it's really not a big deal during the recovery. The only thing I really didn't do was shave because I just want the skin to exfoliate naturally by itself. I don't want to force anything. So I hope this video has been helpful for patients that are considering halo or just wasn't sure what halo was or what laser is. And I just want to kind of reiterate that halo is anybody's really a good candidate for halo. If you're currently getting injectables, whether it's neuromodulators or fillers, you'd be a great candidate for halo. And anytime that you come in for a consultation, even if it is for laser, I'm not really here to sell you on halo. I'm here to sell you on a result. So if halo is not the right thing for you, I am going to recommend other treatments. And that's the beauty of being here at Oceandrive Plastic Surgery. We don't just have one platform. We have dozens of platforms to help you achieve your goals. So on behalf of myself, Dr. Durkin, our master estheticians, our nurses, thank you for watching, and we look forward to meeting you soon.